Our next slide is on muscles also crossing the hip and knee joints, but more kind of focused on the butt area. So the gluteal muscles are abductors. So they're going to take the leg away from the midline, and they're also lateral rotators. So within the gluteal group, which is also a group or a family, we have the large muscle in the butt called the gluteus maximus. This also laterally rotates the thigh. The gluteus medius also medially rotates the thigh, kind of based on its location. Then we have the gluteus minimus, which is not shown in this image, which also medially rotates the thigh. So the medius and the minimus are going to be synergist muscles. The hamstrings, which are on the posterior side of the thigh, are prime movers of extension. And you should know that the three muscles in the hamstrings are the biceps femoris, semitendinosus, and semimembranosus. So all of them are going to be responsible for knee extension. They cross both the hip and the knee joints. So they're prime movers of thigh extension and knee flexion. They're innervated by the sciatic nerve. So when a hamstring is pulled, that's a very common sports injury. But sharp stabbing pain, which is going to continue going down from the butt all the way to the foot, could be sciatica. And we've looked at these other muscles now, the adductor magnus, gracilis, IT band, biceps femoris, semitendinosus, as well as semimembranosus. The next slide is muscles of the leg. And these various leg muscles produce various movements. So at the ankle, they dorsiflect or plantar flex. At the intertarsal joints, there's inversion and eversion that occurs. And finally, at the toes, they flex and extend. The muscles in the anterior compartment include the tibialis anterior, the extensor digitorum longus, and the last one you're not responsible for. That would be the extensor hallucis longus. So let's look a little more closely at these. The fibularis longus is going to be responsible for plantar flexion, whereas the gastrocnemius is also going to be responsible for plantar flexion. It's going to be kind of the prime mover for plantar flexion, whereas the antagonistic muscle to that would be the tibialis anterior, and that's responsible for dorsiflexion. The extensor digitorum longus is going to be responsible for extension of the toes. Just like the extensor digitorum longus in the upper limb is going to be responsible for extension of the digits, the soleus muscle is deep to the gastrocnemius muscle. So it's also responsible for plantar flexion. You're not responsible for the extensor hallucis longus or the fibularis tertius or some of the rest of them that are on this image. On the image that's to the right, we've already talked about the gastrocnemius soleus. For the fibularis longus, that is responsible for plantar flexion. So we've talked about that. The extensor digitorum longus is extension of the toes. Tibialis anterior is dorsiflexion. And basically the rest of these at the foot you are not responsible for. So I'm going to go ahead and cross them out. For the right side of this image, we have the plantaris and popliteus, which you're not responsible for. We've already talked about the gastrocnemius and soleus that are responsible for plantar flexion. Remember, the fibularis longus is also plantar flexion. You don't have to know the fibularis brevis. So the gastrocnemius in this view has been removed, so it shows the soleus muscle, but it would be deep to the gastrocnemius, just like in the quadriceps, the vastus intermedius is deep to the other vastus muscles.